Calcium. Calcium is the most abundant mineral in the body. The adult human body contains 1 kg calcium. Calcium is present with phosphate as hydroxyapatite in the bone. Sources of calcium include milk, dairy products, cheese, cereals, nuts, legumes, and vegetables. The RDA value of calcium in adult is 800 mg per day. In pregnant woman is 1200 mg per day, and in infants is 300 to 500 mg per day. Functions of calcium. It helps in the formation of bone and teeth. That is, hardness of bone and teeth is due to hydroxyapatite. Adult skeleton contains 1 kg calcium. Second, it helps in blood coagulation. Calcium present in platelets converts prothrombin to thrombin to help in blood coagulation. Third, muscle contraction. Muscle contraction is initiated by binding calcium to troponin. Fifth, it helps in the release of neurotransmitter. Influx of calcium from the extracellular space into the neurons causes release of neurotransmitter. Sixth is the regulation of enzyme activity. Activation of certain number of enzymes require calcium as a specific cofactor. Seventh, it acts as a second messenger. Calcium acts as a messenger for many hormones. Eighth, membrane excitability. Calcium activates the sodium channels. In the deficiency of calcium, it leads to decreased activity of the sodium channels, which decreases the membrane potential, so the nerve fibers become highly excitable, causing muscle tetany. Ninth is cardiac activity. Myocardial activity increases with increase in calcium concentration. Tenth is maintenance of intracellular calcium. Calcium deposits in the bone act as a reservoir that maintain calcium concentration in the skeleton, associated with the sites of bone forming osteoblasts and bone resorbing osteoclasts. 11th is hydrolysis of casein in the milk. Calcium is required for the formation of calcium paracaseinate to increase the retention in the stomach and to facilitate digestion in infants. Absorption. Calcium is absorbed in the small intestine. Factors increasing calcium absorption. The first one is vitamin D. Vitamin D causes synthesis of calcium binding protein for the absorption of calcium from the intestine. Second is the parathyroid hormone. The parathyroid hormone stimulates calcium absorption indirectly by activating vitamin D. Third is acidic pH. Calcium salts are more soluble in acid. Acidic foods favor absorption of calcium from the intestine. Fourth, high protein diet. Basic amino acids, for example lysine, arginine, derived from dietary proteins increase the absorption of calcium. And fifth is lactose. Factors decreasing the absorption of calcium. The first one is phytates and oxalates. Phytates present in cereals and oxalate present in green leafy vegetables bind with calcium, forming insoluble salts. Second, high fat diet reacts with calcium to form insoluble calcium soaps. Third is high phosphate content. Phosphate decreases the absorption of calcium. The optimum ratio for calcium to phosphorus is 1:2 to 2:1. And the fourth one is high fiber diet. Excretion of calcium is mostly by the small intestine through feces, sometimes through the kidneys or by sweat. Plasma calcium. The concentration is 9 to 11 mg%. Calcium is present in three forms: the free form, bound, and the complex form. The free is present in 50%, bound 40%, and complex 10%. It helps in the function of three main organs, that is bones, kidneys, and intestine, and also in the function of three main hormones, that is vitamin D, parathyroid, and calcitonin. The four major processes are absorption of calcium from the intestine by vitamin D, reabsorption of calcium from the kidney by parathyroid and vitamin D, demineralization of the bone by parathyroid and vitamin D, mineralization of the bone by calcitonin.